Okay, so let's talk about a medication that has this fascinating double life. I mean, on one hand, it's a serious, life-saving heart drug, and on the other, it's kind of a secret weapon for getting clear skin. This is the story of spironolactone. Let's dive in.
It sounds pretty wild, doesn't it? A single pill that a cardiologist might prescribe for heart failure is the same one a dermatologist gives for hormonal acne. These two things couldn't seem more different. So, what on earth is the connection?
Well, the secret isn't some kind of medical magic. It's actually just some very clever and partly accidental science. This pill is a master multitasker, and it all comes down to it having two very different and very powerful jobs inside the body.
All right, so think of spironolactone like a coin. On one side, it's what we'll call the water regulator. Its main job, its designed purpose, is to block a hormone called aldosterone. But you flip that coin over and you find its other identity, the hormone blocker. This is its surprising ability to block androgens, male hormones. And these two actions, they explain everything. So let's start with its day job, the whole reason it was invented in the first place: regulating water and salt. This is its primary function, and it's why it's so incredibly important in treating heart conditions. To get how spironolactone works, you first have to meet its main target, a hormone called aldosterone. You can think of aldosterone as a little messenger that runs to your kidneys and basically screams, "Hey, hold on to all the salt and water you can." And when your body does that, the amount of fluid in your bloodstream goes up, and so does your blood pressure. So what does spironolactone do? It pretty much plays musical chairs with aldosterone. It gets to the receptors in your kidneys first and steals the spot. With aldosterone blocked, your kidneys get the exact opposite message: let go of sodium and water. But here is the really clever part, its superpower, if you will. Unlike a lot of other diuretics or water pills, spironolactone tells your kidneys to hold on to potassium. The end result? Lower blood volume, less strain on your heart, all while saving that crucial mineral. And this is why it's a cornerstone treatment for heart failure. It's been proven to help people live longer. It's also a powerful tool for managing tough-to-treat high blood pressure and severe fluid retention, known as edema. For these really serious conditions, this drug is an absolute workhorse. Okay, now for its other personality. This is the one that made it a superstar in the world of dermatology. This is its off-label life, its side gig, as a hormone blocker.
So for this job, the target isn't aldosterone at all. It's a group of hormones called androgens. Now, you probably know them as male hormones like testosterone, but they're actually present and really important in everybody's body. The problem is when androgen levels get a little too high or are out of balance, they can trigger things like acne and unwanted hair growth.
And this is where spironolactone's second act really shines. By blocking those androgen receptors on the skin, it helps dial down oil production. This makes it incredibly effective for that stubborn hormonal acne women often get, especially along the jawline and chin. It's also a go-to treatment for hirsutism, that's male pattern hair growth, and it can even help slow down certain types of female hair loss. Now, this right here is where you can really see the two different jobs in action. Just look at the dosages. For heart failure, a patient might be on a tiny 12.5 or 25 milligram dose, but for hormonal acne, that dose can shoot all the way up to 200 milligrams. And for severe edema from liver disease, it can go as high as 400. It just goes to show you how the dose is so carefully tailored to the specific job at hand. Of course, when you have a drug with two really powerful actions, you're gonna get two sets of potential side effects. The drug's benefits are a classic double-edged sword, and the side effects are a direct result of the very jobs it's designed to do. It breaks down pretty logically. On one side, from its diuretic action, you can get high potassium, dizziness, and, well, you'll probably be running to the bathroom more. On the other side, from its anti-androgen action, it can cause things like menstrual irregularities, breast tenderness, or a lower libido. See? Each set of side effects is a perfect reflection of one of the pill's two personalities. But among all of these potential side effects, there is one that doctors watch for more closely than any other, and it all comes down to this: K+, the chemical symbol for potassium. The number one risk with spironolactone is something called hyperkalemia. Remember how we said it's potassium-sparing? Well, sometimes it can spare a little too much.
And having abnormally high potassium levels in your blood is serious business. We're talking it can trigger dangerous, even life-threatening irregular heart rhythms. This is why regular blood tests are not a suggestion, they are absolutely mandatory. So, because of these risks, using spironolactone safely means you have to follow a pretty strict set of rules. Think of it like a user manual for patient safety, and these aren't just suggestions. Let's start with the most important rule, and there is absolutely zero wiggle room on this one. Spironolactone is what we call contraindicated in pregnancy. That means it must not be used, period. No exceptions.
And here's exactly why. Its anti-androgen power, the very thing that makes it great for acne, is the problem here. The drug can cross the placenta, and if the fetus is male, it can block the hormones that are necessary for normal male characteristics to develop.
So the user manual is crystal clear. Step 1, mandatory blood tests to check your potassium and your kidney function. Step 2, be careful with your diet. That means avoiding a lot of high potassium foods and, really importantly, salt substitutes. Most of those are just potassium chloride. And step 3, reliable contraception is an absolute must for any woman of childbearing age taking this medication. And you have to be extremely careful about other medications too. Combining spironolactone with anything else that raises potassium levels can be really dangerous. We're talking about obvious things like potassium supplements, but also some very common blood pressure drugs like lisinopril or losartan, and even everyday painkillers like ibuprofen. It is crucial that your doctor knows every single thing you are taking. You know, this quote just sums it all up perfectly. It's a multifaceted medication. Its primary role makes it a life-saving drug, and its secondary role has, kind of by a happy accident, serendipitously, made it a cornerstone of treatment for hormonal acne and hirsutism in women. It's an incredible story of medical discovery, isn't it? A drug designed for the heart ends up becoming a go-to solution for the skin. It really makes you wonder, what other secrets are hiding in plain sight in the modern pharmacy? Thanks for joining us for this explainer.